Thank you for joining us today as we announce further details regarding our state's preparedness efforts for coronavirus, also known as COVID-19. As of last night, we have our first confirmed case of COVID-19 in Tennessee. Our Commissioner of Health, Dr. Piercy, will provide specific details about that case and guidance as well for what we can all do going forward to stay healthy and to mitigate risk. As confirmed cases surfaced in other parts of the world, we in Tennessee prepared early. Tennessee was one of the first 5 states to begin COVID-19 testing, and we continue to remain confident in our ability and in the measures that we're taking to prevent the spread of this infection now that it is in our state. We're actively engaged in our COVID-19 task force. We named that task force of professionals and of members of the healthcare community, the agriculture community, education community, stakeholders from around the state. We're actively engaged with that task force, even as early even this morning, and we have regular engagement set up with our task force to provide information as well. We're also very connected to and in constant communication with the Centers for Disease Control. We feel very prepared as a state, started before cases ever began to arrive in the states. As we've seen this week in Tennessee, preparedness is critical. And I have full confidence in our preparedness plan that we have put in place. I also have full confidence in our Department of Health and in their strategy from this point forward and the preparation that was made prior to this point. While this is a serious situation, I urge Tennesseans to keep this illness in perspective, as the vast majority of cases are mild and manageable. Serious, but we must keep it in perspective. Simple actions that we'll talk about later, but simple actions like washing your hands can go a long way in us together helping mitigate the situation. Dr. Piercy will now provide details about the confirmed case and about the state's efforts and what we do going forward. Dr. Piercy?
Thank you, Governor Lee. Good morning, everyone. Thank you for joining us. The Tennessee Department of Health has received positive test results for the first case of COVID-19 in Tennessee, the illness caused by the novel coronavirus. The TDH State Public Health Laboratory tested the individual yesterday and has submitted results to the Centers for Disease Control and Prevention for confirmation. While we are saddened to learn that this virus has now reached Tennessee, our recent preparedness efforts that the Governor just mentioned have positioned us to respond swiftly and thoroughly. We have been anticipating identification of COVID-19 cases in Tennessee, and we are now working closely with the CDC and local healthcare partners to identify this patient's contacts and contain the spread of this disease in our community. At this time, the overall risk to the general public remains low. The patient is an adult male in Middle Tennessee with a recent history of out-of-state travel. While we typically do not disclose county-level data on patients, given the recent severe weather impacts on some counties in Middle Tennessee, we are sharing that this patient is a resident of Williamson County. TDH staff have been in contact with this patient, and I have also personally spoken with him. He is currently isolated at home with mild symptoms. His household contacts are quarantined, they're at home, and are in the process of being monitored and evaluated for COVID-19. We continue to emphasize that the current risk to the general public remains low, and the same precautions taken with the flu should be taken with COVID-19. While this is a new disease, we have learned that most patients with COVID-19 have a mild respiratory illness, including fever, cough, and shortness of breath, and do not require hospitalization. However, a smaller number of patients can have severe symptoms that do require hospitalization, particularly among the elderly and those with chronic medical conditions. At this time, COVID-19 is not widespread in the United States, so no additional precautions are recommended for the general public. However, there are some things that citizens can do to prevent the spread of respiratory viruses like COVID-19 and seasonal influenza. TDH strongly encourages Tennesseans to wash your hands often with soap and water and use alcohol-based hand sanitizer if soap and water are not available. Cover your nose and mouth with a tissue when you cough and sneeze. Don't touch your eyes, nose, or mouth with unwashed hands. Stay home if you're sick, and avoid close contact with those who may be sick. Individuals with health concerns about COVID-19 should contact their medical providers. A growing amount of information can be found on our website, tn.gov/health, or through our trusted partner organizations at the CDC and World Health Organization. Before we go into the question and answer session, I will remind you that we just learned of this situation last night. We are committed to transparency and wanted to get this news to you as soon as possible. We know you want specifics on this case, but we want to be able to give you accurate information and to not speculate. Please be reassured that we are working diligently in the background to identify and contact those that were potentially exposed. And in our commitment to transparency, we will issue additional details as we learn specifics. That concludes my formal remarks, and I will now open the floor for questions. Joining me today to help answer your questions are Dr. Tim Jones, Chief Medical Officer, Dr. John Dunn, State Epidemiologist, and Dr. Mary Margaret Phil, Medical Epidemiologist. We'll take questions in the room first.
This is Pearson Kelman, the Tennessean. You mentioned that the single patient recently had out-of-state travel. Can you tell us where that travel was to, and if there's been an established link to another known case or source of this infection at this time?
We are still working through those details at this time. Again, we just learned of the case last night, spoke to the individual just hours ago, and those details will be forthcoming.
Do you know when this person returned back from travel, or how long they were away?
They returned approximately 4 or 5 days ago.
Do you know where they went? Are you allowed to tell us?
We're still working on their travel pattern at this time.
Was it international travel?
It was not international travel.
Presumably it was at Nashville Airport, though?
We're waiting to confirm that.
Can you tell us a little bit about the state's testing capabilities, the number of test kits you have, potentially the number of people you could test if you needed to, and when you'll have more?
That is a topic of much discussion these days. I want to reassure you that Tennessee was one of the first 5 states with testing capability. We've been testing here in the state since February 20th and have had multiple individuals tested and all tested negative until the case that we told you about today. As you are probably aware, the process for commercialization of testing has been expedited, and we have capacity now with overflow capacity at the CDC, and the commercial test kits should be available very soon.
How many tests have been performed so far?
I don't have that exact number, a handful.
How many tests does the state have available, test kits?
It's limited capacity, but we have plenty for now. I don't know the exact number.
Commissioner Piercy, yesterday you told reporters that the state was going to survey how many masks they had and how, the other resources. When is that going to start? And it seems like this is pressing now.
Yes, I'll ask Dr. Dunn to address mask availability and supply chain.
Just for people on the call, the question was about mask availability and supplies.
Can you say your name and last
Yeah,
name?
my name is Dr. John Dunn, the state epidemiologist. So we've already sent out some inquiries to some of our healthcare partners. We have a number of systems in place through our healthcare coalitions and our preparedness program, the Public Health Emergency Preparedness Program, whereby we can request that information through electronic systems. So we're staying in close contact with our providers and working with our partners at TEMA and other state partners to evaluate what's on hand and what's needed.
Could you tell us what made him come in? Did he think he had it, or how did that play out?
I'll ask Dr. Phil to fill you in on some of the patient information. She has been in the most contact with him.
Thank you. So the question was, what prompted the patient to seek medical care?
I'm sorry, can you give us your name?
Sure, Dr. Mary Margaret Phil. So the patient, fortunately, as was previously said, has very mild symptoms. He did have some progression of his symptoms to be slightly worse, and that was what prompted him to seek care. I think it's important to note that clinicians that evaluated him acted appropriately and immediately contacted public health and took all of the appropriate precautions.
And I've been researching, and when you say wash your hands, we all take that very lightly. I was told scrub your hands for 20 seconds or longer. I just, for some reason, I think that's a point. And we touch our faces 40 times an hour. We don't even realize it. Can you address that real quick?
Yes, so the question is about proper hand washing techniques. As you mentioned, proper hand washing is at least 20 seconds, covering all the surfaces with water and soap. If water and soap are not available, alcohol-based hand sanitizers also are effective if used properly. As you aptly mentioned, we touch our faces and noses and mouths much too often, and so I would ask the public to be more cognizant of that and make sure your hands are clean frequently.
I know you said his household is quarantined, but have they come in contact with other people? Have you reached out to those other people? And just how are you guys going about trying to just keep this contained, for lack of a better term?
The question is about containment of household contacts. We have been in contact with them since last night. They are quarantined at home and have expressed a sincere desire to be compliant with that. We are currently compiling a list of their potential contacts and are actively, as we speak, in the process of reaching out to those contacts and triaging them for their symptoms and potential testing.
Do you know how much time passed from this patient returning from out of state and them testing positive for the virus? How much time they were in Tennessee when they didn't know they had this?
Sure. So the question was how long the patient potentially was in the state prior to knowing the diagnosis. Fortunately, this patient returned from their out-of-state travel and became ill, and as we often encouraged people with any type of respiratory illness, they began to self-isolate at that time. So the duration from when they became ill until we knew the results was short, within a matter of days, but their activity outside of their home was very limited during that time period.
The handful of people that were tested, did they have any international travel or out-of-state travel? Any ideas that prompted them to get tested as well?
There are very strict, the question is about testing criteria. There are very strict guidelines on testing criteria published by the CDC. Many of them did have an international travel history. Some of them had unexplained and severe pneumonia, but the vast majority of them did have an international travel history.
And I know you guys don't want to freak people out, but I'm sure there are people at home wondering, oh my gosh, it's here in Nashville. We just had a tornado. What can you say, or maybe the governor, what can you say to just keep people's mind at ease? Because there's so much going on in the span of what feels like 48 hours.
Yeah, it has been a very difficult week for our state in a lot of ways. People are suffering, just beginning to recover, tens of thousands of people dealing with the effects of the tornadoes, and now this news about the coronavirus. But I think the thing that we need to remember is that preparedness is how we deal with situations like this. It's already been evident that the preparedness for the storms and the work together from federal agencies, state agencies, local agencies was strong. The response from the community has been strong. Difficult, but that preparedness was important. The same is true here. You know, I was in Washington, D.C. Weeks ago and met with the CDC and other governors to begin to prepare for the day that this might happen in Tennessee. And because of that, we named task force. We put in place a preparedness plan. We have a strategy for communication of all the folks involved. I think that earlier I said we need to keep this in perspective. I think that's how we keep from overreacting to a very serious situation. We don't want to understate the seriousness of the situation, but we also want to remind folks that keeping it in perspective is important. The vast number of cases are mild. The disease appears to not affect, in significant ways, children. The mortality rate is low relative to other diseases. All of those things make the risk here in our state continue to be a low risk, but being prepared is the best way to mitigate. And I will say again too, it sounds like little things like washing your hands a lot and not touching your eyes and face and sneezing into your elbows and not going out if you're sick. Those are the things that Tennesseans need to do. In the same way that we come together and help our neighbors, we do that individually by doing the things that we're responsible for. And they're simple things, but they're important.
We're going to open up our phone lines now to take questions from media joining on the phone. We will unmute the phones on this end. If you will press *6 for those on the phone to unmute your line. Please identify yourself and your organization before asking your question.
Yes, Andy Sherritt with the Chattanooga Times Free Press here. I came in a little bit late. Can you just give me a brief recap? And do you know what state that person was had traveled from? Was it California or Washington State?
Thank you, Andy, for the question. The brief overview is a 44-year-old male from Williamson County who returned a few days ago from out-of-state travel. He is still working with us to give his travel history, and we are in the process of tracking that now. If you didn't hear earlier, we just learned of this last night, and so details are still forthcoming.
Thank you.
And just to be clear, you said he's in Williamson County, or is he from Williamson County?
The question is he in Williamson County or from Williamson County? The answer is both.
Commissioner, I have a question. You were talking about testing. Do we know how many people have been tested for potential coronavirus cases?
Dr. Jones, do you want to handle that?
This is Tim Jones, Chief Medical Officer. A handful of people have been tested in Tennessee. We currently have limited capacity to do testing, but as many of you have heard, that's likely to increase soon. We're currently following CDC guidelines about whom to test. They're quite strict. If clinicians have questions about who to test, they have been contacting us, and we have been giving them advice and permission to test if they follow CDC guidelines.
You're saying a handful, 5, 10. Do we have a specific number?
We don't have a specific number now, but we currently have enough to test all of the people that fit the CDC guidelines for testing.
I think his question was how many. Do we have a number of how many have been tested? You
I don't. I do not have an exact number. I'm sorry.
Andy Sherritt with the Times Free Press. Can we get an exact number? I mean, a handful means 5 or less.
Andy, this is Dr. Piercy again. We will be able to publish that information soon. At this point, I can estimate plus or minus 10.
I know you guys mentioned you don't know entirely what his travel plans were, but if BNA was part of that, what's that next step?
So we will make proper notifications, as the governor mentioned and put out yesterday. The CEO of the Nashville International Airport is on our task force. We have been in contact with him this morning, and if we determine that the patient passed through that airport, we will let people know appropriately.
That's the last question we have time for this morning. We do have a news release about this.